What's the difference between diagnostic and interventional radiology? We're back with our brand new career battle series where we compare two different medical career options to help you decide which is the best path for you. We'll break down compensation, lifestyle, length of training, and the pros and cons of pursuing each career path. Dr. Jubal, MedSchoolInsiders.com. In our first video, we covered the differences between doctors and surgeons. Next up in the battle arena, by popular request from our subscribers, is diagnostic radiologist versus interventional radiologist. The basic difference is that diagnostic radiology primarily deals with diagnosing disease, and interventional radiology primarily deals with treating disease. Diagnostic radiology involves using medical imaging technology such as X-ray, CT, MRI, ultrasound, mammography, and various nuclear studies to diagnose disease. Diagnostic radiologists don't usually take the images themselves, but instead spend the majority of their time looking at the finished scans and providing interpretations of them for the clinical physician who ordered the scan. They are known as the doctor's doctor. Interventional radiology, on the other hand, involves using medical imaging technology to treat and sometimes diagnose conditions. Using imaging guidance, which is typically a kind of real-time X-ray called fluoroscopy, interventional radiologists often manipulate long, thin wires called catheters to the site or organ of interest to then perform a procedure. These procedures are known as minimally invasive, as traditional invasive surgeries require far more cutting than a needle stick or small incision. So how is training different between diagnostic and interventional radiologists? Training for both paths begins with the same 4 years of medical school. Residency is where the paths differ. Overall, training is longer for interventional radiologists. Residency is typically 5 years for diagnostic radiologists, whereas interventional radiology residency lasts 6 to 7 years. For context, the longest residency path, neurosurgery, is also 7 years. Diagnostic radiology residency begins with an intern year where you obtain clinical training focused on various internal medicine or surgical rotations. This internship is often performed at a different institution. The subsequent 4 years are dedicated to your radiology training. This means as a PGY1 or postgraduate year 1, you'll be an intern, and as a PGY2, you'll be in your second year out of medical school, but in your first year of radiology training, also known as R1. On the other hand, there are 3 possible pathways to becoming an interventional radiologist. The first is the integrated pathway, which includes 1 intern year, 3 years of diagnostic radiology training, and 2 years of dedicated interventional training. Since the path begins with diagnostic training, it's helpful for those who are still unsure which path they want to pursue. You can keep your options open for a few more years after medical school. The second is early specialization in IR, also known as ESIR, which includes 1 intern year, 4 years of DR, and 1 year of IR training. This is generally for DR residents who realize early on that they want to do IR. They will complete more IR rotations during their DR years than the other 2 options. The final year of DR training, PGY5, is mainly focused on IR rotations. To go this route, you need to know early on that you want to do IR to get the required 500 IR procedures during your DR years. The last option is the independent IR residency, which takes the longest at 7 years. This training includes 1 intern year, 4 years of DR, and 2 years of a separate IR fellowship. This path is usually taken by DR residents who realize late in residency that they want to do IR. Additionally, both diagnostic and interventional radiologists may choose to further subspecialize. Diagnostic radiology can subspecialize with a fellowship in breast radiology, neuroradiology, pediatric radiology, body imaging and MRI, and more. To learn more about the subspecialties within radiology, check out our video, 10 Radiology Subspecialty Career Paths Explained, linked in the description. Technically, interventional radiology is a subspecialty of radiology, but you can also further subspecialize as an interventional radiologist. For example, interventional oncology or pediatric IR. Next, how does the compensation compare between diagnostic and interventional radiology? Since IR is a subspecialization of DR, reliable salary reports, such as Doximity and Medscape, don't report interventional radiologists separately. On average, diagnostic radiologists make $532,000 a year. However, this includes those who chose to subspecialize in IR or another area of radiology, as well as those in private practice who typically make more than physicians in academic or community settings. Recruiting websites claim that IRs make approximately $80,000 more per year than DRs, though differences in salary are likely far more dependent on whether a radiologist is working in academic or private practice. Private practice radiologists, both diagnostic and interventional, can make significantly more than radiologists in hospitals or academia. Radiologists are currently in high demand, as there is a significant and growing shortage of radiologists in the US. Could AI account for this shortage? Find out in our detailed breakdown of when artificial intelligence will replace radiologists, link in the description. How do diagnostic and interventional radiology compare in terms of lifestyle? Diagnostic radiologists typically work 8 to 5 Monday through Friday. During residency, you'll normally have occasional weeks of nights, as well as some weekends, as well as occasional days of late call, which means working until 8 or 9 p.m. As an attending, especially in private practice, you can often take more or less call depending on how much you want to work. Diagnostic radiology has one of the best lifestyles in medicine, as you'll have adequate time off, you can practice in a variety of work settings, and there is increasing flexibility for work from home and teleradiology options. Plus, if you want to work more and make more money, you can do so, and if you want to work less and make less, you can do that too. When it comes to interventional radiology, at a busy center or large hospital, scheduled IR cases can start between 7 to 8 a.m. and run until 5 to 6 p.m. This is in addition to call. However, less busy centers will have fewer cases. Not all interventional radiologists will be operating every day. Academic IRs may only do procedures and have a day off for admin or research, and private practice IRs may do a mix of procedures and DR reads. Overall, the IR lifestyle is worse than DR, but it can still vary once you're done with training. There are IR attendings who work close to general surgery hours and others who work closer to DR hours. IR call is usually home call, meaning you can be called in at any hour and on weekends for urgent interventions such as internal bleeding, trauma, stroke, and pulmonary emboli. These happen often, meaning you may have to go in at 3 a.m. or multiple times a weekend. Now, what are the pros and cons of becoming a diagnostic radiologist? Let's start with the pros. DRs have a great lifestyle and compensation, and the work is interesting and cerebral. If you're naturally curious and enjoy puzzles, diagnostic radiology is just that. All of the clues are right in front of you, and all you need to do is piece together the information to find the diagnosis. You can have patient contact and do procedures if you want, and you can practice in a variety of settings that are increasingly flexible, such as working from home and teleradiology. DRs also don't have to deal with social work, such as dealing with insurance and disposition issues, calling consuls, acting as a secretary, and so on. You're also able to leave work and not take it home with you while still helping a large number of people. However, this does bring us to a con. You won't have longitudinal patient contact, and you will not often be involved in patient care. This means many patients won't even be aware of the key role you played in their diagnosis. You'll also need to have a vast knowledge of all organ systems and diseases given the nature of your work. Call during residency can also be challenging at times, although note that radiology residency is more middle of the pack. Not as extreme as surgery, but also not as approachable as family medicine. Even as an attending, increasing imaging volume means there's often pressure to read more and as fast as possible. There can also be legal liability and potential for lawsuits. Now, let's consider the pros and cons of becoming an interventional radiologist. A major pro is you can help people instantly and literally save lives. There's also a huge scope of practice, and you can intervene all over the body. IR is a rapidly evolving field with new interventions being developed all the time, so there are many different niches to establish yourself in. For example, IRs are DR certified, so you can do part IR and part DR as an attending if you want. And similar to DR, there's minimal rounding and social work. To top it all off, if you like tech, IRs utilize cutting-edge technology. That said, the lifestyle and call can be challenging, and you'll face difficult hours during residency especially. And speaking of residency, interventional radiology is a competitive specialty to match into, ranking as the 6th most competitive of 22 specialties. Comparatively, DR is close behind in 8th place. On top of that, you'll spend many hours standing, there's a danger of radiation exposure, and turf battles can sometimes exist with other specialties depending on the institution. For example, you could come into conflict with vascular surgery for peripheral vascular interventions and neurosurgery for brain interventions. So, which career path is best for you? People who thrive in diagnostic radiology are intellectually curious, enjoy solving puzzles, and are comfortable with both working alone and outside of the limelight. Your work will be extremely important, but most patients won't even know you exist. On the other hand, interventional radiology is ideal for those who are interested in imaging, minimally invasive procedures, and more patient interaction and recognition. However, just like with surgical specialties, this comes with less work-life balance and more call work. Both DR and IR are unique fields that are impossible to appreciate without first-hand experience, so we strongly encourage you to complete a rotation or shadowing in both before deciding on your medical career path. If you haven't already, check out our So You Want to Be series, which covers both diagnostic and interventional radiology in more detail. What medical career paths would you like us to cover next? Psychiatry versus neurology, doctor versus nurse practitioner, or EM versus trauma surgery? Let us know in the comments and share your other ideas.